Very interesting. And do you know how as clinicians we can utilize PSMA imaging to predict future biochemical recurrence risk? Is that something that's being thought about?
Yeah, so this is a very relevant question, I believe, from a clinical standpoint, because there is not much published that I know of for the use of PSMA-PET in the prediction of risk of biochemical recurrence. But it is a very important topic, especially from a clinical standpoint. As I was mentioning, the proof of that is that the European Association of Urology, they developed these risk scores that divide patients that have BCR, or biochemical recurrence of disease after radical treatment, into two main groups based on some clinical parameters. So there's a group that has higher likelihood of developing metastases and disease progression, and those that have lower risk. And this is based on clinical parameters, as I was saying, like the PSA doubling time, the Gleason score, and the time interval between the therapy and the development of BCR. So obviously PSMA-PET can play a role in this, because after primary curative treatment, be it radiation therapy or radical prostatectomy, almost up to 50% of patients will experience BCR. But what we really want to know is, what we want to understand, which ones of these patients that experience BCR will develop metastases and disease progression. So there are a couple of studies that I can think of. One is a multi-center study that was done between some centers in the United States, UCLA, UCSF, Michigan, and in Europe, Germany, and Italy. And they looked specifically at PSMA-PET used in patients that were stratified based on the EAU's risk stratification. And they realized that basically the PSMA-PET is highly associated with the stratification done based on the clinical parameters. So the majority of patients that have high risk based on this clinical criteria, so the EAU risk stratification criteria, have higher likelihood of having a positive PSMA-PET scan. Those that have low risk, they have high likelihood of having a negative PSMA-PET scan. But there are also the cases that are discordant. So those cases in between that have low risk and metastases on PET, or high risk clinically and no metastases on PET, those are the cases that we're really curious about. I'm curious to look at the long-term follow-up in these patients, and I'm sure that there will be studies. I know of one study that was published in Australia by Louise Emmett's group. They looked at patients. They were stratified based on the risk stratification groups, and also based on the results of PET. So they had patients with a positive and a negative PET, patients with a high risk, and patients with a low risk. And basically what they were able to show was that both PSMA-PET status and the risk groups were independently predictive of event-free survival. So they were both predictive independently. And this is really important. So absolutely, this is a very relevant question. I believe that PSMA-PET has additional prognostic value, and we should be considering adding it in the future of risk management.
Okay, very interesting. And aside from those specific studies, are there any future clinical trials or currently recruiting trials that you think you're specifically interested in, or might change our management of certain patient populations?
Yeah, sure. We've talked about oligometastatic disease. We talked about radiation therapy planning. I'm really looking forward to seeing the results of a study that we're conducting at UCLA with UCSF. It's a phase 3 randomized study that is looking at patients with biochemical recurrence. These patients were randomized into two groups. One group would receive PSMA-PET and salvage radiation therapy based on the results of the PET, and the other group would receive conventional imaging and radiation therapy based on the results of the conventional imaging. So this study was done with basically the endpoint of looking at success rate at 5 years. So we're only looking at patients who will actually receive radiation therapy, and this is going to be at 5 years. I know that the last patient was recruited in 2020, so we're looking forward to the results of this. This is a long-term follow-up that will prove eventually, as we were mentioning before, that there is actually an impact of these imaging scans on progression-free survival. But overall, it's a very exciting time for PSMA imaging. I'm looking forward to seeing many more collaborations. I was really happy to see that there were really productive collaborations in the studies that were involving PET and also radioligand therapy with PSMA, like for instance, the collaboration between UCLA and UCSF that brought to the FDA approval of gallium PSMA-11, and also the collaborations among the Australian group. So I'm looking forward to seeing many more collaborations if we come together. That's the story, the successful story of PSMA. So I'm looking forward to seeing more of that.
Okay, that's very exciting. And for our last question, we kind of alluded to this earlier, but when we were discussing the different half-lives between the different radioisotopes, but it seems like the access to PSMA-based imaging is very regionally localized to specific areas of the country. Do you have any ideas on how we can kind of expand access to PSMA-based imaging to patients across the country and in other nations where these types of nuclear medicine studies are harder to access?
Yeah, I think it's just a matter of time. If you think about it, PSMA was developed, the first clinical studies that were done with PSMA-PET were in 2015. The first study that we did with the PSMA-PET at UCLA was in 2016. And we're in 2022, we have already 2 PSMA-PET radiopharmaceuticals that are approved by the FDA. So it's just a matter of time. And there are a few things that make me optimistic in terms of making it more accessible and more widespread. For instance, recently there was another approval for a kit that will allow the synthesis of gallium PSMA that would help produce this radiopharmaceutical more easily and distribute it more easily. But there are a couple of things that make me really optimistic. So, for instance, in the US, this is relevant in the US, we received Medicare and insurance coverage, which is very important. So that's going to definitely change things. And another really important aspect, I believe, is the approval rate from the clinicians. I see that there is a lot of excitement, a lot of interest, and a lot of hope from the clinicians. So the urologists, the GU oncologists, the Red Onc, they are really supporters of PSMA-PET. And a proof of that is the fact that the NCCN guidelines in 2022 incorporated PSMA-PET in their guidelines. So when the clinicians support this imaging, I think that's an important step that is only going to improve the widespread use. And in the end, that's what we're looking for. We want this tool that we've worked on developing to be available for our patients, and that's the overall goal. So I think it's just a matter of time, but it's going to happen.
Okay, thank you so much, Dr. Sonni. I really appreciate your time today, and for taking the time to speak to us about PSMA-PET imaging. We hope to interview you for other topics in the future.
Thank you. It was a pleasure to be here. Thanks a lot.